So when we have acid in the presence of a tooth, well, how does that necessarily cause a cavity? Some of you are like, well, duh, the acid erodes it. But some of you guys like to be a little bit more scientific. So if we want to talk about that, we can talk about one principle called Le Chatelier's. I think it's a French man from way back. But Le Chatelier's principle is actually very simple, kind of common sense, but you can apply it mathematically to make it a little bit more practical, which is simply things tend to move towards equilibrium. If we have two sides of a coin, if you have a whole lot of stuff over here, less stuff over here, the whole lot of stuff gonna move to the side with less stuff so they can equal out. Same thing with temperature. Something super hot here and you put it on a super cold plate, there will be a heat exchange to a degree to where both the plate and the hot thing start to become around the same temperature. So we can do that same application when we talk about acidity, pH. It's the same situation. So again, if we have some acid producing bacteria on our teeth and we provide them with food, as our good friends in the kitchen told us, if we apply sugar in the presence of this type of bacteria, what we get is acid. So how does acid going around the tooth break down that tooth from this strong thing to this mushy cavity hole that you were talking about earlier? Well, it's simple. Like I said, things like to go towards equilibrium. So teeth are actually made up of this molecule called hydroxyapatite. It's part of crystalline structure, which kind of gives teeth their structural integrity, makes them real firm. It's the same mineral that kind of makes up bone. It makes it very hard and dense. And so you have this molecule which is comprised of a few different things. You got calcium. You always think drink your calcium. Milk, bone strong. Think that, strong calcium. Phosphate, chemistry word, you don't need to get too deep in that. And hydroxide have an acid, and those molecules, which we consider base-like, they will start to balance out. So you have the acid on the outside, it sees the basic nature of those molecules or those minerals which make up hydroxyapatite in the tooth. And what it will start to do is just start seeping a lot of those bases out, because acids like to pair with bases to form this neutral water equilibrium, and then a salt is a background, is like a byproduct, but it's the same thing. So calcium and phosphate get seeped out, and also hydroxide can be used that way as well. So they're just seeping out the minerals which make crumble and become weak. And so now you have this weak, mushy, crumbling structure of tooth, rotten tooth, which is now decayed because of the acid mixed in with bacteria, and it's like wet, mushy mess. That's how dentists can kind of tell if you have a cavity, because they're feeling it here. Now this one's pretty obviously a cavity, but there is a world where this is not. You know what I mean? Like there's a world where this is not. And why I mean that is because, like I said, maybe not to this degree, but certain things, coffee stain, tea, coffee, plus other things, tobacco, there's a bunch of different things that can stain teeth. And you can even have cavities kind of start on the outside, and then you provide a therapy to them. We'll talk about the therapy a little later, to go ahead and stop the cavity, and it will still have this dark color turning effect. So you can't necessarily diagnose a cavity just by looking at them unless you can visibly see a hole. Like this picture over here, you can visibly see the hole, so that is literally a cavity. The other one, I can't visibly see a hole, even though I'm 95% sure, 99% sure that's a cavity, but there's that 1%. I don't know, because I have not felt it. So when a dentist is going around your teeth and feeling, what they're feeling for is to see if this is still intact, still strong, it's not mushy. Okay, if it's mushy, that is what tells us everything we need. So again, a cavity is just that damage caused to the tooth, turning it into this mushy mess that no one wants to deal with, and it's infected, it's no longer healthy, and it's going to continue to produce acid and keep going, because now the environment's more acidic. It's going to grow more of those acid producing bacteria on it, and it's going to just keep this process going and keep tunneling through that tooth until it gets to the nerve, and you come to the doctor yelling, screaming, all that type of stuff. So after bacteria are on the tooth and they start to replicate a whole lot, many bacteria, they decide to do, or organisms do, when they want to become stronger, and they band together. So there's a movie, Planet of the Apes, where Caesar had a group of sticks and he held them together, and it was only like one or maybe two, and he broke it, and he showed apes apart weak. So like if we're fighting, we're weak, but then he put a bunch of sticks together and tried to break it. He couldn't, to demonstrate that apes together strong. This is what we see with bacteria and a plaque. When they band together and form the plaque, actually make them more resistant to you detaching them than they would individuals. So what do we do with this information? Well, we want to focus on two things: prevention and restoration. Now, prevention is something you can focus on at home. Really only something you can focus on at home, because all you have to do to prevent the cavity from forming is break up or disrupt this process at any point in time before the acid production turns into loss of those minerals that are vital. That process of losing those minerals is called demineralization. How do we do that? Well, we can literally physically remove the bacteria and or the plaque from the teeth. Because if there's no bacteria on the teeth, no plaque on the teeth, then we're not producing acid and we're not going to decay the tooth, assuming that you don't have acid reflux or something like that. So there we go. So just physically, mechanically removing this. Now, of course, this is better done with like an electric toothbrush, because that's like a power washer versus like scrubbing something. But it doesn't have to be. Even going back into ancient times, people used to use these bristled sticks called miswax. When I was a little kid, I went to a school and we had a few professors at the school. It was a lot of Middle Eastern teachers at this school. It was a Muslim school. We had a lot of people walk around using miswax to clean their teeth. Now, this is a perfectly fine way of cleaning your teeth, but you would have to do it pretty constantly to keep trying to break up this formula. So they would do it all the time. They wouldn't just grab random trees and do this. They would actually use a specific tree, like something called the Salvadora persica. And that tree, the bark of it naturally contained fluoride. That's one of the main reasons it was also effective. So what does fluoride do? So remember that hydroxyapatite molecule I was telling you guys about? What fluoride does is twofold. One is fluoride, instead of having regular hydroxyapatite, it will start to substitute out for the hydroxide groups. Remember I told you this was going to be important, this little OH group right here? The fluoride will take its place. And fluoride is actually a much bigger molecule than the hydroxide molecule, also making it a more stable molecule and something harder to break down. So if we look at like hydroxyapatite versus fluoroapatite here, you can see big dark blue circles are the fluoroapatite, the small one hydroxyapatite. This molecule, the big one over here, is just much more difficult to break down than the hydroxyapatite. So if you're in an acidic environment and acid is trying to seep away those minerals, the result of breaking that tooth down is going to be much slower in a fluoroapatite tooth than it would in a hydroxyapatite tooth. The second thing is this process is always ongoing. Like I said, these bacteria are always present everywhere. A lot of times, or many times, people do not brush in time to stop the beginning of turning from the acid to seeping out the minerals. But that's okay, because if it's still barely started and you apply fluoride, you actually increase the chance of the tooth remineralizing and still turning into a fluoroapatite tooth, to where the tooth rebuilds into being even stronger than it was before. So as long as you're brushing pretty frequently, that is the main thing you want to do to protect yourself. And it's not just a process on the losing side. You have natural elements in your body already that fight these cavities, such as saliva. They act as buffers to not allow the pH to sway but too much. But still there will be pH sway, and because people don't brush that often, especially not as often as something like a miswax would require, then the presence of fluoride really allows for, when you brush, making that potent, so you can remineralize your tooth and make your tooth already a little stronger on the outside. So that's the main purpose of like toothpaste. Toothpaste contains a few other things in there depending on the brand, but the main thing you're getting from it, besides the mintiness, is the fluoride remineralization. All right, so now brushing with fluoride and the frequency of that are the most important thing. But what about those x-rays that I showed you earlier? The thing is, fluoride wouldn't prevent many of those cavities. Why? Because those are in between the teeth. You can't really brush those away. If you watch people brushing, they're not really brushing in between the teeth. You also got to make sure you floss. This is why flossing is very important. You're cleaning the sides of your teeth. So if you think about your teeth have about 6 sides to them, or a third of which are in between the teeth. So when you're not flossing, you're literally saying, I'm not gonna clean a third of my tooth. Now to do that, you can use regular string floss, as we all know, or you can use a water floss or a water pick, or you can use these floss picks right here. Some people don't think these are as good because they don't think they bend as much to try to clean the teeth. You're just trying to if this is your tooth, you're trying to get a side of the tooth and just kind of, get the stuff from under there. I have a little questionnaire that I want to run through. The quiz things we already talked about. We already answered one of these questions before, but I will just answer them again, and we'll see who has been paying attention. So, what factor directly causes dental cavity? We see sugar as an answer choice. We already know that sugar can lead to cavity formation, but I don't know if sugar is directly going to cause it, because if you have sugar and no acid, you don't have a cavity. Acid directly causes it. Bacteria produces the acid from eating the sugar. Toothbrush abrasion, I mean, you'd have to have some really serious toothbrush abrasion to cause a cavity, so this is pretty far out there. Number 2, do you need fluoride to prevent tooth decay? Do you need fluoride to prevent tooth decay? Yes, no, yes, no, yes, no. If you answered no, you would be correct. Remember, fluoride helps significantly. Practically, you want to use fluoride to really help yourself not have to clean your teeth all the time. Does fluoride significantly help in preventing and remineralizing tooth decay? So we did just kind of answer that. So the answer would be yes. Fluoride does significantly help in preventing and remineralizing tooth decay. Number 4, can water flossers be adequate substitutes for string floss? And the answer to this is yes, according to the research that I've linked there, not according to my dental school professors who literally told me opposite. Number 5, what is the most important aspect of brushing teeth to prevent cavities? All right, now, again, you should have answered D. Brushing at night. Brushing at night, very important. At night, your saliva production goes down. And remember, saliva is one of the main things that protect us from getting cavities. It's nature's buffer to help prevent your mouth from getting too acidic. And it also has some antibiotics and other things that fight cavities in there. But the main thing is its buffering effect to not allow things to be super acidic. So when you go to sleep, you stop producing as much of that, and you actually become more prone to dental cavities. At night, make sure you brush before you go to bed, but it's not most important. So it is important, not most important. Use of fluoride, we talked about, very important. Remember, makes the tooth stronger, helps remineralize the teeth. Very important, not most important. We can still prevent cavities without having any fluoride present. C, brushing technique, also very important. You want to make sure you brush very thoroughly and effectively. Now I would say, in my opinion, most people don't really brush perfectly anyway. So even though technique is important, not the most important. In my estimation, brushing frequency is the most important. You just want to disrupt that process of demineralization and start the process of remineralization as frequently as possible. Don't allow food to sit on your teeth so that bacteria can use them to produce acid. Just constantly brush it off, disrupt that process, and you'll be good. So that's the end of that video today. Just what causes a cavity. I'm also gonna have another video coming out soon about what is a dental filling. If you like this video, if you enjoyed it, I'm trying to do more of these dental education type of things. Like, comment, subscribe. It really means a lot to me. New small creator, just starting making some content because why not, all right. But that's it for today. I'm Tooth God. That's what causes a dental cavity, and yeah.